So let's start. Uh, Hello everyone, I'm Ashlesha here from Blue Circle Diabetes Foundation. Thank you so much for joining us today. And today we are in conversation with Dr. Pranita Darade. She's a gynecologist and obstetrician at renowned hospital in Pune, Gupte Hospital. The scope of services include all types of low and high risk pregnancies, gynec endoscopies, PCO clinics, and premarital and preconceptual clinics, all gynec operations, etc. And she practices in Pune, mainly in Pune, in areas like Deccan, Baner, and Baudh. Okay, so our today's topic is about hormones. Now, hormones might seem like a very small word or very weird word, but this is an aspect of a woman's life, body, physical health that can, if not balanced properly or took care of, can actually cause a lot of havoc. Be it your physical health, your mental health, your food preferences, what you eat, how is it digested or absorbed in your body. So if you glance at it at the first, it seems like a very small thing, but in actually, if you look into it or try to read more about it, you can get a clear idea of what exactly it is. And that's why we are here today, and we're going to talk about all about hormones and diabetes in women health. Okay, so this topic we are going to explore because it comes under a Project Gaia. This special session has been organized under Project Gaia. And Project Gaia is a special initiative from the Blue Circle Diabetes Foundation, in which we try to learn more about and talk about each and every aspect that is related to women and diabetes. So without further ado, I would like to invite Dr. Pranita. Hello, Dr. Pranita. Please introduce yourself in brief again.
Uh, Thank you so much. Good evening, everyone. Anyways, Nisha has, said a lot about me. So again, just to say that I'm consulting gynecologist and obstetrician working in a renowned Gupte hospital at Deccan since last 12 years. And we are dealing with all many, hormonal problems with the females. We can get started with the thing so that, more and more questions and answers can resolve your queries.
Yes. So for those who are joining now or are joining us for the first time, please feel free to ask questions in the comment section. We would, of course, be taking it up in between and in the end as well as time permits. So please don't be shy if you have any question, related to your own health or someone else's that is going through something. Please type it in the comment section, and we would definitely take it up and try to answer each and every question. Okay. So let's begin with Doctor. My first question is, what are hormones and what is like hormonal imbalance or hormonal changes that we talk about?
True. In every body, the hormonal system, or we call it as the endocrine system, is the very important. It plays a very important role. So it's just like as any other system, like a respiratory system or a digestive system, which includes from starting point to the end point all the organs, its functioning, and all those things. So to make all the systems work properly, we need certain hormones to be secreted in our body, right? So we have a whole endocrine system which is made up of many, many, many glands, and then they release something called as hormone in your circulatory system, and that causes the proper metabolism. They are responsible for many things: the reproduction, the metabolism, overall your mood changes, and all also depends on the hormones. They are very important to run your body properly. I mean, even if we have the all physics absolutely fine, we want the functioning going absolutely well, for which the hormones play absolutely important role. Imbalance of the hormones. Truly, yes. I mean, nowadays, what is happening? There are so many reasons, the vast number of reasons behind the hormonal imbalance. The lifestyle changes which are occurring nowadays, overall, the over medications, which or self medications rather than the over medications, lack of exercise, they are all responsible for causing the hormonal imbalance. Along with that, there are certain systemic problems too. I mean, the endocrinologist can tell you about that in detail. If any kind of hormonal gland is not working fine, then also the hormonal imbalance can happen. As a female, I want to, share this loudly that anyways, as we grow from our puberty to the reproductive age group to the perimenopause, premenopause to menopause, there are anyways going to be the various hormonal changes happening in our body. So in that changing version also we can actually experience the hormonal imbalance. We can have experience that in a monthly cycle too. If my cycles are not regular or something of that sort, then also I experience such kind of things. So it is very important to know your hormones, know your body, and what are natural things uh, to control that and how to go about it.
Okay. Okay. Thank you, doctor. So the next question is, when does hormones actually are activated in your body, or when does it actually start working?
Right. See, hormonal system, if we say it is active since birth only.
Okay.
Few of the hormones, like the sex hormones or what we call it as the reproductive system hormones, they are activated from the puberty.
Okay.
So if we, majorly discuss about the reproductive system as being a gynecologist, we need to know about when exactly that starts happening. So that is from the puberty. All the pubertal hormones come in: estrogen, progesterone, follicle stimulating hormone, luteinizing hormone, many, many more. Okay. And as they again fade up in your perimenopausal age group to menopause, the similar kind of things happen in males too, because the testosterone and all those things do come in uh, the pubertal age group, and then they fade in the andropause, right? But the fluctuations are more seen in females because they have actually the monthly cycle going on, and then which shows us depletion or increased value of the hormones every time.
Okay.
But other
Okay.
hormones are there since birth. They are acting there. The thyroid, other cortisol, and all other hormones are always there since birth.
Yeah, hormone insulin as well, I think.
Yes, absolutely. Yes.
Yes. Okay. So the next question is this something that only occurs when in a woman's body, or is this something that can happen to a male as well?
Absolutely. In a human body, gender doesn't matter. Okay. The
Yeah.
hormonal imbalance can happen to anyone. Now,
Okay.
that depends which kind of hormone is getting abnormal in your body. That tells you if this is something regarding the estrogen, progesterone, and all that may happen with the females more. If it is related to the androgens and the testosterone, that will happen to males. Okay. But other hormones like the insulin impairment or the hypothyroidism and all those things, they are equally similarly predisposed to both the genders. So it happens in males as well as females.
Okay. So this is not something that is gender specific.
Not at all, not at all.
Okay. Okay. Uh, the next
Females,
question is,
unfortunately,
hmm,
have the more hormonal imbalances in their life. But
yeah,
then their role is like that versatile role of females. So that is why the versatile hormones in them.
yeah. So I know this might be a very huge topic, but can we get into what are the causes, behind this, especially in females? What are the causes that can be seen? Because I think, especially after COVID, there has been a very huge rise in cases related to hormonal imbalance.
Right. I mean, even I want to share this thing. I mean, since we
Hmm.
studied in our MBBS, and
Hmm.
that time, whatever we have actually, got educated towards about the hormonal imbalance, we are seeing almost 3 to 4 fold rise in that hormonal imbalance in the self practice right now. So definitely, the hormonal imbalance is on a higher side. The environmental factors are another cause, but yes, your lifestyle changes, where the sedentary lifestyle is there, where no exercises are there, lot of junk foods people are eating, more of packaged foods, preservatives, all the liking for pizza, burger, and everything. And you must have noticed about in some few years back era, the menstruation for the females used to start by about 14, 15, 16, like that, at the age
Yeah.
of that year. Nowadays, what we are seeing is even the menstruation is happening very early. Even 9 years of girls are getting the menstruation, menarche, what we call the first menses, right? And similarly, the age of menopause is changing. Where the menopause used to happen 50 plus, nowadays that is happening even just at 40s also. So we are seeing all those things. Main important aspect of it is the lifestyle, which is becoming sedentary, and it's not, I mean, it's not including the exercise as well. It's not including yoga, pranayama, and all those things which are very important. Sitting jobs are increased.
Yeah.
Previously, people used to do all kinds of work, the household work. They used to go to the
Yeah.
well to take the water, do all house chores on their own. Previously, we did not have the gadgets like mixer or anything of that sort. Well, they had to do all those turning and everything. So, if you go towards certain types of exercises, they are all similar exercises which females earlier used to do. They used to do that zato and churning. That is the exercise now we are doing on the name of for PCO care or something like that. So that is happening. And of course, some kind of endocrinal impairment. There may not be actually a change in the lifestyle, but the system is at fault and then it secretes the hormones in a different manner. So that time we have to investigate out and find out only lifestyle modification will not work for them, then they definitely need the medication. So such types of genetic predispositions also are the important causes for hormonal imbalance.
Okay. Yeah. So the next question is, which types of food can help you restore the hormonal changes or imbalance in your body? Is there any particular superfood or cure sort of thing?
It's a good question, but I want to answer it in a ulta, I mean, absolutely opposite way. Let's see
Hmm.
what is not to be eaten. Okay.
Okay. Yeah.
Rather than yes, because what is happening is what we have actually started entering in our food habits, and that is causing the trouble. So, as I just now told you, packaged foods, tinned foods,
Hmm.
any kind of the preservatives are added in that. We are nowadays going towards very quick methodologies. Whatever is ready to eat, we prefer that
Hmm.
because we don't have time. We are more career oriented, and all those things are preferred. But let me tell you, all these things have certain ingredients which actually directly affect your hormones, or those ingredients actually act as the mimicking hormones, and that is why the whatever the hormones are secreted in the body, they get disturbed. Whether it's this is the source or actually endogenous source is the source of the hormones, they get confused on that. Another thing is utilization of plastics. I mean, we call it as endocrine disruptors. We had a huge conference where also, in reproductive medicine conference, it was about the infertility. But what we finally came to know about the root cause as we have to actually take out all the endocrine disruptors from our life. So plastic is one major important thing. So actually, we have to take out the plastic. We are not eating, but we are eating in the utensils. We are drinking water, drinking packaged water is in the plastic. They have certain elements which actually mimic like the hormones, and then the excessive hormone is exposed to the body.
Okay.
Along with that, actually we have to go organic. Nowadays it is the trend is going on definitely, but that has to be little more precise, that organic things are to be preferred, where less of the pesticides and less of other things are utilized. We are seeing the dairy products. From where do you get so much of milk? They give steroids or any other hormones to the cows and buffaloes and get the milk out of it. Processing is totally different. So all these things do matter. So we have to take out these things from our life. So less of cut off your plastic, cut off your non-organic foods, cut off your packaged foods. Then we come to what are the foods which were there in our life, and they were actually called as superfoods only, where rich source of fibers, where you have to eat lots and lots of fruits, fresh fruits, of course. Dry fruits are the good source. Nuts are the good source of omega fatty acids, which will give the proper balance of the hormones. Another thing is that proper gut microflora. I'll just, emphasize a little more on that. Previously, as well, 2000 years ago, the Hippocrates, who is the godfather of medicine, has said each and every disease starts from the stomach. पेट से चालू होता है. Okay.
Yeah.
Why he used to say that? Because 70% of our immunity actually starts from your gut immunity. So your gut has to be more absorbing. So otherwise, what we say, food, you are what you eat.
Yeah.
Nowadays, we want to change that. You are what you actually absorb. So I may eat anything, but my gut may not be so strong to absorb everything. So that is why absorption of the gut has to be better, and that is why gut healthy foods like yogurt, little fermented foods, nuts again, the complex carbohydrates. Ideally speaking, though, I'll be speaking about the low carb diet for the hormonal balancing system, but ideally the gut healthy food has to be there. You can get n number of videos on gut healthy diet on YouTube also, but of course you can check with your gynecologist or endocrinologist or your doctor too what basically helps you. But daily intake of freshly made curd, dahi ka use, is the very good source of gut microbiome. And there are almost, let me tell you, trillions of bacteria, which are good bacteria also and the bad bacteria also. So when we take such kind of fermented or the curd like stuff in our system, then the good bacterial flora is more and more flourished and the bad bacteria is taken out. So what it was a previous diet in our ancient times, that finally can be called as a superfood, I guess.
Yeah. And I think it's also catching up, like you said. People are, I think, currently on the trend that, we have to eat those superfoods. I think people nowadays also are trying to consume more of millets, which used to be a staple food, at least in India and, Southern Asia.
Absolutely. The complex carbohydrates are going to be the choice of India, I feel, because that is going to release so less sugar and the timely sugar release is there. And that's why the
Mhm.
millets are getting so more and more, popular nowadays.
Yeah. Yeah. So the next question is, can hormonal changes affect your diabetes, your sugar levels, basically?
Yes. Now, let's come to the reproductive hormones, what we are talking about. I mean, because that is the more important issue in females nowadays. And
Mhm.
that's why, I mean, diabetes and the female hormones have actually insulin resistance. That is
Mhm.
something is called with the hormonal imbalance. And insulin resistance is already existing in the diabetes. And
Yeah.
that's why both of them go hand in hand to increase the disease pattern. Okay. So in the earlier age to the reproductive age, you must have heard about the occasions of PCOD or PCOS. Almost
Mhm.
95% of the females are knowing this, that they are having it. Okay. Every fifth to 10th female is suffering with the PCO. But if something like this is coming in, okay, that cannot be normal. Yeah, ये सबको है तो अभी this is becoming a normal trend and this is not the disease, is not the truth. Because what we see is, yes, it is to her also, it is to her also. So then that is fine. We can avoid it and do not take any kind of advice from the doctor. But that is not so. So let me, put some flash on the PCOS also. What exactly happens? You must have experienced in our lives. We all have experienced these things, that the menstrual cycles can get erratic. They can be very prolonged ones, or they can be very short ones with the heavy bleeding, or can be a scanty bleeding pattern. Sometimes there are a lot of acne spots. Sometimes there are thick blackish skin over the nape of the neck. There
Yeah.
are excessive hair growth over this area or the chin area or on the abdominal area also. And the coarseness of the hair also changes. So all these symptoms are the symptoms of actually you entering into the PCOD. Now, what is the difference in PCOD and PCOS? Is a difference of When only the ovaries are affected in your body, that is called as a disease. But when along with the ovarian involvement, when your system gets affected, and the PCOD is so old in your body that it is causing insulin resistance, then you are more prone for diabetes, then you are more prone for hypertension, then you are more prone for heart attack, and all these systems get involved in it. Then it is called as PCOS. So once we diagnose the things at the PCOD level, we are very sure that we can actually manage it well just with the lifestyle modification also, or with just few medication. We don't need to have many more things. PCOS is something where I may say that will be, can be controlled lifelong, but it cannot be treated completely because it has involved the system altogether. And that is why it is very important to, follow the proper diet, the low carbohydrate diet, follow the proper exercises, because the further problems like getting pregnant becomes a problem, fertility issues are there, obesity is one more aspect associated with PCOD. Then other involvements, like I told you, the early diabetes, early hypertension, early cardiovascular changes, all those are associated with it.
Okay. The next question is, can contraceptive pills or devices, that are usually used, can they also cause hormonal changes in a woman's body?
No, actually, I will say it other way, where when you are diagnosed to have hormonal changes, then we use these contraceptive pills in a different manner to treat the hormonal imbalance. So, per
Okay.
se, use of contraceptive pills will not have any effect on your hormones. Of course, they are hormones, or probably a very excessive use of it on your own without the guidance of a doctor can cause, but otherwise they are the treatment part. In the medication part, we have to utilize them as the treating agents rather than this. And devices, definitely no. Devices will not have any hormonal effect on your body, the
Okay.
contraceptive device.
Okay. So as long as it is used by through the prescription of a doctor, I think it's safe to use. You shouldn't buy it like
Yes,
over the counter or anything. Okay.
yes. Nowadays, everyone is Google savvy, media savvy, and they want to, treat themselves on their own. So, what I always tell my patients also, the Google gives you information A to Z, but where you stand, whether you stand at A or you stand at P, you don't know. So, you can't, just keep on reading the information regarding Z and get the treatment of Z to you. So, that's
Yeah.
why where the person called as doctor comes into the picture, and where you have today have studied your system, and that is where they can help you better, examining you, checking you. There are certain investigations required to prove that yes, this is the hormonal imbalance, and because the imbalance is there, you need the medication. So all those things in a mannered way we are supposed to do. Definitely not self medication.
Yeah. Okay. The next question is hormonal imbalance something that is said to be hereditary, or is it not hereditary?
A part of it can be said hereditary because genetic predisposition is one thing which is kind of applied to each and every problem. So
Yeah.
hormonal imbalance to some extent can be hereditary, but cannot be, put majority changes of the hormonal imbalance are happening because of the lifestyle changes and all these things what we discussed just now. Heredity part can be there, but cannot be blamed completely or 100%. But yes, I mean, the person, we call it as, the life cycle concept. So what is life cycle concept? If I give birth, if I am diabetic, okay, and I give birth to a female child, and that at that time my diabetes was not very controlled. So then that female child is going to get the more proneness to get kind of PCO, obesity during her pubertal age group. Similarly to the male child also, the major predisposition towards diabetes. And then these girls who are more prone for PCO, who are more prone for obesity, when they grow and then they have all these the fertility issues, then they conceive, and then also their kids can have the predisposition. So likewise, we call it as the genetic predisposition to the further generations. But it's not
Okay.
absolutely true. If I am
Mhm.
diabetic, I am completely controlled during my pregnancy on my sugars, on my hormones. I may not pass it on to my baby. So, and if I take care of my kid at her pubertal age group, that she should not get into obesity, she should not get into the puberty problems, she should not get into actually the PCOS, which is with the lifestyle modification, of course. So then she will not have. So that's why cautiously whole society has to understand the lifestyle modification is the underline of probably today's topic.
Yeah.
Of course, further medications and all part comes up if even after the lifestyle modification you are getting the trouble, then only.
Yeah, I think it's so normalized. I mean, it is like you said, the number is really high, but I think we should also look at it that it's really alarming. That is like a warning for us, and not just like normalize it and be like, yeah, she also has it, I also have it. So what?
Yes, yes, and that is happening. I mean, many of the patients who come to the clinic, they are saying, two, three people from her age group or the college going girls, they all have it. Only thing is that this symptom was little different, and that is why I approach you. So
Yeah,
if they have a very common symptom, they usually don't approach the doctor at all then.
yeah. So we have a question from the audience. Preeti ji is
Okay.
saying, I am 40 and type 1 diabetic. Her gynecologist gave her contraceptive pills to treat hormone imbalance, but now she's diagnosed with menopause. Is early menopause related to diabetes?
Uh, we can't have directly yes or no answer to it. Namaste, PPG.
Yeah.
Okay. Basically, what happens is because of diabetes, definitely your hormones fade away little early. But it cannot be because you are a type 1 diabetic and that is why you get the menopause earlier. It's nothing like that. But then after you are diagnosed to have menopause, still you are on contraception. I mean, if it is so, then we may have to stop the contraceptive pill, or there can be some different thing, because what happens is the endometrial lining respond in various different ways. So if the endometrial lining is thickened, to treat that also we have to give hormones, or the whatever people called as contraceptive pills is the hormonal pills for me. Okay, it's not always uh, used for contraception. These are the pills which can be used for contraception, which can be used for hormonal balance, which can be used for postponement of the menses, many things. So just like that, people say it's contraceptive, but not necessarily everyone uses that just for the contraception.
Hmm.
So diabetes can have some role, but it's never ever a direct say. Just because you are diabetes and that is why you are menopausal early is not the say. Nowadays, the era itself is changing. Where, as I, few minutes back only, I told you about the early menarche and the early menopause. We
Yeah.
can fall into that group.
Okay. Yeah. I hope Preeti ji, this answer your question. So doctor is saying that diabetes is not maybe the final cause that why maybe you are starting menopause so early on. There could be other underlying factors to it as well.
And
Uh,
now, if you have already entered a menopause, you must have done the hormonal checkings, and that is showing the menopausal changes. So then you are ideally supposed to take care of yourself to avoid the menopausal symptoms further. Whatever the osteoporosis, where the bones become very brittle, all those cardiovascular protections of the estrogen level goes low. So all those things you should meet a gynecologist and take a proper diet, take the proper protective medications towards it. There are a lot many non-hormonal menopausal medications also. So you can go ahead for that too. But take a proper gynec advice towards it,
okay.
rather than having a question about ki, "Arey, abhi kya?" I mean, if I am a early menopausal, then what will happen to me is should not be the. case. Ideally, it should be always how to deal now in a healthy manner towards it.
Okay, yes. Next question is Usha ji saying, in my family menopause starts from age of 50, and I'm 49 and a T1D, and my periods are still going on. Should I worry or should I go for a checkup to keep my diabetes control most of the time?
I'm so sorry, Ashlesha, I could not get your question.
Okay, yeah, no worries. I'll repeat. So, Usha ji is saying, in my family, menopause starts from the age of 50, and she's currently 49 and a T1D, and her periods are still going on. So, the question is, should she go for a checkup? Is it still, she's still getting the periods, and what should she do to keep her diabetes control in most of the time?
Her diabetes is type 1 diabetes or type 2
Yes,
diabetes?
type 1. She's T1D.
Uh,
I'm audible?
no, you were not
Okay.
a few seconds back, so I'm
Okay.
just wanted to
Yeah.
repeat
So
it.
she's T1D.
Okay, okay. So basically, what happens during the menopausal changes or perimenopausal changes is that probably your diabetic changes or the diabetogenic property of the body goes little higher, where maybe if at all you are taking the insulins. I mean, of course, you are insulin dependent diabetes, so you will be taking the insulin for that. The requirement of insulin can be on a higher side also, but that happens only during the interphase from the reproductive age group to direct menopause. And there, yes, role of the diet obviously comes up, which T1s follow absolutely well, I'm sure on that. But still, always and always, I mean, sometimes, I have found out when they have something called as insulin in their hand, they are not so much worried about, gulp something. Like,
Yeah,
like
yeah.
ठीक है, I can take two more units
Units.
of the insulin and I can eat this. That happens more to in the T1 rather than in type 2 diabetic. They are more cautious because they are just
Mhm.
on the medication. So how much
Yeah.
medication they will increase, like that. So here the diet comes absolutely, absolutely at the top, where
Mm.
she has to be perfect. It is basically, making a routine perfect for yourself. It cannot be absolute haphazard thing कि हाँ आज का दिन ऐसे चलेगा, कल का दिन वैसे चलेगा. No, your day has to start with maybe a yoga, pranayam, exercise. You have to drink major amount of water throughout the day. Low carbohydrate diet has to be followed very, very meticulously. So
Mm.
then we experience the sugar fluctuations little more. And of course, T1s are very, very expert in managing their insulin doses. But yes, in spite of that adjustment, it is not getting rectified. Then diabetologist can help you out with, maybe change of certain different insulin or something like that. And you can take help of a gynecologist too, where is there any help of non-hormonal or hormonal menopausal supplements which can taper off, because what happens in the menopause is suddenly the progesterones and the estrogens are completely going to zero. They go in a lower manner, and then when they are going very, very low, at the same time the follicle stimulating hormone rises, the luteinizing hormone is again shooting up, and that's why all these changes happen.
Okay. Yes. She's also worried is that her periods have not stopped yet, and most of her
Okay.
friends who are of her age have already stopped their periods.
Right, right. But it depends, and even if
Mm.
her family members are have got the menopause by the age of 50, it's not thumb rule that she will also get it at 50. It can be 49 for her, it can be 52 also for her. So,
Mm.
absolute definition for menopause is once she stops the period for a actual time phase of 1 year, then only she'll be called as menopausal. And if someone is wanting to know whether really I am perimenopausal or no, then they can do the hormone testing. The gynecologist can help you see which hormones are to be tested. Most commonly, the follicle stimulating hormone, that FSH level, is the one which can tell you whether you are really into the perimenopause or no.
Mhm. Okay. Yes. I think Ushaji, as doctor suggested, you might need to get a few more tests done to get to the root cause, of why maybe your periods are not stopping and what else can be done about it. So I hope this answers your question. So the next question is, doctor, uh, any hormonal can hormonal imbalance or change lead to depression or postpartum depression, or anxiety, as we can see are is like, I mean, cases related to that are as well on a really rise.
Yes, yes, definitely. I mean, the direct answer to this is yes, because what happens nowadays is because of so many changes in their career orientation, or maybe I can say in student life, they are having so much of pressure about the studies, the competitions, and everything, that
Yeah.
the stress level is more. We should understand whenever the stress level of the body is on a higher side, we release more and more of a cortisol. Cortisol is called as a hormone which is going to take you, flight or fight response. So because of that, your alertness is on a higher side, then the nervousness and all. And the persistent release of cortisol in your body is going to make you insulin resistant also, and because of which the good hormones which are going to keep you calm, the calming hormones are going to go down.
Okay.
And that is why then the depression starts coming into the picture. So,
Okay.
of course, they go hand in hand. If they start with a cycle of getting into the depression, then they are certainly going into the hormonal imbalance. And the more and more of imbalance of the hormones lead to the depression more. Now, one more aspect, what you asked about the postpartum depression. It is
Yes.
altogether a different entity where what
Okay.
happens is post delivery, the limbic system, which controls your emotions, is absolutely playing a different role. Sudden release of prolactin, sudden increase, sudden depletion in the oxytocin, and all these things. I mean, the sudden changes in your hormones just to feed the baby. You should get the good milk supply, and all these changes are happening in the hormones for that particular thing, can make you prone to develop the depression, which is usually more evident in first 6 to 8 weeks post delivery. So we actually call it as the postpartum blues. That kind of every female experiences that. But yes, the moral support from the family, and knowing that stuff on your own, then eating good things, being in our normal senses, because there are so many things post pregnancy which are changed post delivery. The things are completely changed, where what you were and concentrating on yourself, now you have baby to look after yourself. Someone is saying something, someone is guiding on the diet, someone is telling you to eat something different only which you don't like. So all those things is get you into the nervousness, and that
Yeah.
excessive nervousness then finally lead to the depression also. So not that each and every female will go into depression, but each and every female post delivery can experience these blues, which if she is aware of, she can control and avoid going into the postpartum depression.
Yeah.
I mean,
Okay.
there are almost like 2% females which we have to, refer to the psychologist also, refer to psychiatrist also for the medication when they actually have many, many symptoms showing the major depression post delivery. That is a entirely different issue.
And the next question is related to about, if someone is diagnosed with depression, say, because of this, can it be said that the hormonal or the the pills, the antidepressant pills or the pills that are used to maybe for this condition, can they also cause hormonal imbalance, more of it, or?
See, any over medication, as I told you, can
Yeah.
cause it. But
Okay.
certainly, if uh, the pills are recommended for the depression, okay, they are for the betterment of the depression. I mean, we have to take what is getting more problematic in her life. I mean, she's getting more troubled with the depression, or she's getting more trouble with the hormonal imbalance. Because sometimes, yes, to some extent, the antidepressants can cause hormones to vary, but that is basically meant for her betterment and getting her out from the depression, her or him, of course. So that is why then we have to, tackle the hormonal imbalance in a different way. We can't say that this pill is causing the hormonal imbalance, so now you stop, because she's totally dependent on that.
Yeah.
And that is where then a different aspect of the therapy starts. Then more of counseling, and that thing helps in. Right? So that here definitely a doctor's role comes up, where just generally I will do this or that, and that will not serve the purpose.
Yeah. So I think as long as it's prescribed by a doctor and you have not been taking it for a long time and doing everything else to help yourself, then this might not be the only cause for hormonal imbalance in your body.
Definitely. And if you are experiencing any different things, once if you take certain pills for a longer duration, as per the advice of a doctor, and then you experience certain mood changes, or you experience certain depressive effects or anxiety attacks or something like that, you can straight away, jolly well tell it to your doctor that I am experiencing these things, especially after this medicine. So they can help you out. If some molecule is not suiting you, they may change the molecule, they may change the medicine for you. But it cannot be stopped on your own. That is what I mean.
Yeah. Okay. Understood. Yes. Uh, can hormonal imbalance over time to lead to pregnancy issues, or maybe cancer or serious infections, especially in consideration to your reproductive system? Can this be an effect of having this for a longer period of time?
Absolutely, yes, because the hormonal imbalances, as I told you, I mean, from the puberty, if someone is having the imbalance and going into ovarian issues like polycystic ovaries or something, then what happens? The major thing what happens is they go into the anovulatory cycle where they do not ovulate well. So if they are not ovulating properly, then definitely they are going to face the fertility issues, because for the fertilization or for getting the pregnancy done, there has to be a proper egg coming out every cycle, and then only it can be utilized. Another thing what happens is, even if with maybe supportive therapy or certain medications, the person ovulates also and she gets pregnant too, and during pregnancy also, uh, because of the hormonal imbalance of PCO, she can have more predisposition towards getting into the gestational diabetes. Okay. So though in her lifetime she is not diabetic, but she can be a prone person to get the diabetes of pregnancy. More and more GDM is the gestational diabetes, short form of gestational diabetes. GDM is getting more and more prevalent nowadays. Again, because of the obesity, sedentary lifestyle, no exercises, and then they are getting conceived, late marriages, late conception trials, more of what we call it as IVF and IUIs. I'm not saying we should not do it, but this is all having the effect on the pregnancy. And then after all, what is the effect is more of GDMs can make you more predisposed to get the diabetes for lifetime also. It's never like yes, there is a gestational diabetes, and now after delivery, now it is absolutely well. 50% of them can develop the early diabetes in their life. Okay. So definitely in pregnancy, the hormonal imbalance plays a lot of role. Pregnancy itself is a situation, we call it as a diabetogenic situation, where the placenta is the thing, var जिसको बोलते हैं, which provides the nutrition to the baby. So placenta also secretes certain hormones in the pregnant lady. So those placental hormones, glucagon-like hormones are there, which also act as the insulin receptor blocking agent, and they are because look alike a insulin like molecule, that is why then your normal insulin doesn't work on them. And that's why during pregnancy, if you are already hormone imbalance, then the imbalance will be worsened during your pregnancy, which which can be tackled. Of course, it is never like nothing can happen with the
Yeah.
proper consultation with it's a co-consultation, we always call it as, if it is a GDM, then you have to have a co-consultation with your gynec and the diabetologist, dietitian all together. If it is a hypertensive disorders because of something, then you should have a physician, gynec. So these are the co-consultations. These are the situations where the co-consultations are required.
Mhm. Okay. Yeah. The next question is, what kind of treatment works best for hormonal imbalance? There's a lot of, I think, prevalence of maybe, try Ayurveda, or should one go for homeopathy or allopathy? How is that determined in person if a patient
Yes.
comes in?
Uh, um, a tricky question,
Hmm.
but yes, still I'll try to answer because I have learned allopathy till now. uh, Less known of Ayurveda and homeopathy, but sometimes when we call it as these are chronic disorders. What do you call the chronic disorders? So since ages or since years, the person is having such kind of problems.
Yeah, yeah.
Then to maintain that, the other pathies, the homeopathy, Ayurveda, have the better effect. So I will not say absolute no to those pathies. But sometimes what happens is the acute uh, treatment. Like if because of some hormonal, I'll give you the example, if because of some hormonal imbalance, the person starts bleeding profusely, where it can lead to such a severe anemia in her case if the immediate stopping of the bleeding doesn't happen, where the
Mhm.
allopathy medications are to be given. So
Okay.
probably we can, mix up the pathies also, where we can take help for the maintenance dose. They can be on homeo and the or the Ayurveda, and for the acute things, any kind of bouts of symptoms are occurring, then they can actually go ahead with the proper treatment in the allopathy. For the short term wale jo bhi hai, those they can take allopathic medication.
Okay. So I think it also depends, like how we different types of diabetic use different types of medications. Even there are so many like varieties of insulins available right now. It's, I think, all trial and error, and it also depends from person to person, right? What is the level of seriousness of this condition in them? You never know. Some maybe Ayurveda might work for some, or allopathy might work the best for someone.
Absolutely. I mean, we keep on I mean, all the pathies have to join hands together
Yeah.
for the better solution. So we should be having, the positive aspects of the chronic therapies from their pathies, and for the instant relief, you can take the allopathy for few days. Something like that has to be, tailored to that
Yeah.
particular patient. It cannot be yes, this is true or that is true. It can be
Yeah.
varied because the whole individual is different.
Yeah. The next question is, can hormonal imbalance cause insulin resistance in an already diabetic patient?
Now that depends on type 1 or type 2, because type 1 is already insulin dependent. So
Yeah.
where the topic of insulin resistance doesn't come. But yes,
Hmm.
few of the T1s are like where they secrete insulin, but to
Hmm.
a very, very lesser extent. In them, definitely, such kind of hormonal imbalances can make them insulin totally resistant. So where whatever insulin they were secreting, that may not, act in their body. In type 2, of course, yes, whatever we have, talked last 50
Yeah.
minutes, that is saying that insulin resistance is the one major, major, major thing. I'll just give you the, what exactly happens in the body, why insulin resistance develops in the body. So when the hormones get deranged, so derangement of hormone is where your calming hormone is getting down, your cortisol level is getting high. The cortisol is going to control the insulin, and that is why the insulin is secreted in your body, but the receptors become absolutely numb. The receptors do not respond to that insulin because of the high level of effect of the cortisol in your body. Okay, so जो भी because of the insulin, what used to happen that whatever the sugar in your body is to be converted into the proper glucose, and that is absorbed in the cell and utilized as energy. That doesn't happen in the insulin resistance. What happens is the receptors do not accept, yes, there is insulin, so it is not going to act on the receptor. So that is why whatever the sugar has come, that remains like that. So much of sugar in the blood, and that is why the spike of sugar in your blood comes up. And that high sugar level then finally gets converted into the storage form, which is a fat, and then deposition of into the adipose tissues, fats, and then obesity, and all those things. All that cycle starts up.
Okay.
So this way, the insulin resistance definitely happens.
Okay. The next question is, are there any physical symptoms of hormonal imbalance? I mean, apart from your periods, getting affected, how can a person recognize that, they could be going through this?
Right. So all these, I mean, the all endocrine systems are different. I mean, the features for the thyroid hormone imbalance can be different. The insulin hormone imbalance can be different. The reproductive system hormones imbalance can be different. But uh, more or less, as we know that the reproductive system hormonal imbalance is more in males as well as females. So the early fatigue, they are getting, irregularities of the cycle. They are getting flows differently, where the menstrual flow is very scanty or menstrual flow is very, very high, or they are getting these what we call it as hirsutism, where the hair grows differently. The head hair, or on your head, the alopecia starts happening. The male pattern baldness starts coming, but all other areas, even on the hands, feet, chin area, they have the coarse hair, or the thickening of their skin, or the blackening of their skin, acne formations. All these are signs of the female hormones or reproductive hormones imbalance in females. The same thing applies in males also. I mean, the lethargy, or because finally what happens in them, in the reproductive age group, because of the hormonal imbalance, if they become more prone towards diabetes, then that directly can reflect onto their seminal parameter, the semen parameters, where the sperm motility gets so much affected, the sperm morphology, the whatever the body, head, tail combination is there, that particular morphology is changed, and that is why we see so much of infertile males too nowadays. So there the balance has to be acquired through medications and the lifestyle modification.
Okay.
For hypothyroid, altogether different symptoms are there. Other, the adrenals and corticosteroids and all those things are altogether different, but most common are these ones.
Okay, okay, yes, got it. A kind request to audience: if you guys have any, questions, we please type it up in the comments, so we could take that up quickly before our time is up. The next question is, ma'am, what effect does hormones have in different food groups? Like, does hormonal imbalance can it affect the absorption of food, or minerals, vitamins in your body? Can that happen?
That is very rare to say that the hormonal imbalance causes the food absorption in a different manner, but rather if you are already having the food absorption problem, then occurrence of hormonal imbalance is on a higher side, which
Okay.
we definitely covered during the gut health,
Yeah.
whatever we talked about the gut health. So definitely what happens whenever there is extra progesterone going on during pregnancy, we can take it as, which is a normal situation in the life that anyone can get pregnant. But during pregnancy, the progesterone hormone is going to cause the less motility. It relaxes all the smooth muscles in the body, and that is why even your gut is made up of a smooth muscle. The intestines slow down. So whatever is going to get digested in you and me in 24 hours, that particular food gets digested in that pregnant lady in 72 hours. So lot of belching, lot of acidity, lot of gases, all these things they suffer with. So these are the normal or natural changes going to happen in their body. So likewise, the absorption is less, and that's why we have to supplement them with the medication. Like from the normal food also, if you and me are going to absorb almost 30% of the iron from the spinach vegetable, they may absorb only to 10 to 15%. It's just because of the hormonal influence on the gut. But that is the expected version during pregnancy. And otherwise, when you are diabetic, uh, or you are on some, the packaged food, or all these fast foods are more in your diet, maida is more in your diet, then what happens is the bad bacteria of the gut grows more and more. And that is why the absorption capacity of the intestines reduces to such an extent that the more nutrient things from the actual food is not getting into the body.
Okay.
And that is where the problem arises. So we have to know whether the naturally it is getting affected, like a pregnancy part, or it is really a pathogenic where we have to treat it. Treat it in a sense, it can be treated just with the some modifications of the lifestyle, or some initial gut flora stabilizers or gut flora improving agents. We call it as probiotics
Yeah.
nowadays, but with opinion of your doctor.
Okay. Yes. I don't think there are any other questions from the audience. My last question is, I think we have heard a lot about cervical cancer in the recent times, especially in the last few months. Can you just briefly touch upon it? What is it? What causes it, and what is the treatment, or what precautions should a female take?
Right. So basically, this question is maybe a little out of our topic, but this is a very
Yeah.
important question where the people should know. And nowadays, because of the media, it is so much evident that everyone nowadays are coming up with whether I can take the vaccine towards cervical cancer or
Yeah.
not.
Yeah.
First of all, I should tell you that there is this great news that only cancer which has a preventive aspect in the form of vaccine is cervical cancer. Now, why does that? You should know what is cervix. Basically, this is mouth of the uterus. Okay. So, in that mouth of the uterus, if any cellular changes are happening, more because of the exposure of human papilloma virus. So, 90% of the cases are because of these HPV viruses. Okay. That can happen to anyone who is sexually active, anyone who is in her reproductive age group, anyone who is in her perimenopausal age group also. So these HPV screenings are also nowadays available. So we can screen ourselves whether we are really carrying that HPV vaccine or HPV virus in the cervix or no. If we are not carrying that, might as well we should get vaccinated. The vaccine is available for a very big age group, like from 9 years till 45 years, we are vaccinating the females. Of course, we are saying that before the first sexual intimacy, if the female is vaccinated, then she is almost 100% protected against the HPV. I'm not saying cancer protection, I'm saying the HPV protection. Okay. And even if like you are already sexually exposed or you are already married, you are having kids, then also some strains of the HPV viruses can become little more dominant and then cause the changes in the cervix. And
Okay.
that is why even them, for them also the vaccinations are the good source of prevention. Okay. So all of them after 25, whatever our protocols are saying, after age of 25, each and every female should be screened for cervical cancer through liquid based cytology, that is similar to pap smear if you have heard of it, but
Yeah.
pap smear in liquid cytology. Okay. And the HPV testing. Fine. That should be at least every 3 years.
Okay.
if you are doing the HPV testing, that can be done every 5 years also. So that is just the test and getting vaccinated. Now, nowadays, they are saying that even the World Health, WHO is also incorporating these vaccine schedule. They have a schedule that these
Mhm.
vaccinations are compulsory. Like that, this cervical cancer vaccine is also coming up. Good thing is that in Indian made, I mean, the Serum Institute of Vaccines are also making the one. We don't have to unnecessarily buy the foreign one now.
Yeah.
So that Servivac also can be utilized. So any vaccine which is told to you by a gynecologist can be taken. They are only 2 or 3 doses. That depends on the age of a female. If she is less than 14 years, then the 2 doses are sufficient enough. If she is
Mhm.
more than 14 years, then 3 doses are required. But that is lifetime. So once you are vaccinated, then again she should not be going for any booster dose or anything. So that's a
Okay.
very good initiative, and all the audience should spread this knowledge laterally to all your near and dear ones to take the help. I mean, help of the vaccine and get everyone vaccinated around.
Yeah. Yeah, I think everyone should definitely get checked, especially if you have a chance to prevent it, or maybe lessen the damage somehow. You should definitely go for it.
And in female cancers, what happens is these are all the internal organs.
Yeah.
So we don't actually see the symptoms first. First, the
Mm-hmm.
changes of the cancer do occur in the body, and then we see the symptoms. So when we see the symptoms, that time probably the cancer can be of the later stage, and
Stages.
that is why screening is more important over here, because
Mm-hmm.
unseen things are there, which are not the external objects. I mean, on skin we can see, on the breast we can see the lump or something, and can be detected early. But cervix is not seen to the female, so she
Mm-hmm.
doesn't know. So screening is the methodology where early detection is always possible, and that can
Yeah.
be treated well.
Okay. Okay. Yes. Thank you, doctor. Any last concluding words, doctor? Any tips or suggestions that our female audience should follow to, take better care of themselves?
Right. So to take care of ourselves in the routine life, I feel lifestyle modification is absolutely the important aspect. Medications and all those things, doctor will take care of it. But
Yeah.
what we have to see towards that, we should not get into the imbalance at all. And for which maybe you have to regularize your day. You have to have exercise every day. Some sort of exercise has to be there. Pranayams do help to release the good hormones in your body, so you can take help of them also. The proper order of your food. I mean, we eat all the good stuff, but order of eating that can be a different aspect. So, what is to be eaten first? What is to be
Mhm.
eaten last in your thali? That also matters a lot. How many servings? That also matters a lot. So, definitely, your doctor can help you on that. But lifestyle modification is the maybe this is the concluding word for us.
Yeah, I think that is one of the ultimate solution to stay healthy and safe, I think.
That's true.
Yes, okay, sure. So thank you so much, Doctor, for joining us and explaining everything in such a little time and so wonderfully. And thank you everyone from the audience for joining us as well. Please stay tuned and do follow us on all our social media platforms to stay connected and stay updated about our future projects, future sessions, and everything. So yes, Doctor, thank you again.
Thank you so much for the opportunity.
Yes,
Bye bye.
thank.